Hello everyone. In this video, we are going to study the principles of the treatments. So in the previous videos, we have discussed how to preserve health or how to prevent disease. Also, from all these studies for these few months, from the study of the basic theories, we already understand the philosophy in Chinese medicine, the physiological function of different organs, also the etiology, the pathogenesis of our theories, how we see our human body, how we see the disease, how we see the pathogens. So until now, you can see we try to recover back to the physiological condition from a pathological condition. So when you, in a layman words, that we said the balance. We want to balance the yin and yang. That's the principle in acupuncture, in Chinese medicine. But how to balance? Balance is quite a layman word. It refers to very broad meaning. So here we're going to study some of the principles of our treatments, how to recover to a balanced situation. The first is the direct and paradoxical treatments. So direct treatment means treating the cold with heat, treating the heat with cold, treating deficiency with tonification, treating excess with eliminating. So as you can see from here, this means that if in a heat condition, the body got excess heat, we're going to use some cold method or some cold herbs to recover the balance. This is very similar in a very hot weather in summer. What are we going to do is we're going to turn on the air condition. We're going to turn on the fan. We're going to balance the environment with the cold condition to the hot condition. That's treating the cold. That's treating the heat with the cold. Treating the cold with the heat. It's very similar. In winter, we feel very cold. Then you turn on your heater. Then you can feel better. That's the same situation. If our body is in a cold condition, we use hot herbs, the herbs with the hot condition, or we use some treatment methods such as massage or acupuncture treatments to increase the heat in the body to balance. Treating deficiency with tonification. Deficiency condition is the weakness or we don't have enough certain substance. We're going to tonify, such as if we got spleen deficiency, we're going to use some method to tonify the spleen. We're going to study all these methods, how to tonify the spleen. Treat the excess with eliminating, such as we got excess phlegm or we got excess dampness in the body, or even from the 6 exogenous pathogens that invade our body. We're going to use some methods to eliminate these pathogens. That's how to recover from disease. This is direct treatment. So this direct treatment is actually quite simple, quite easy to understand because we use the opposite parts to maintain back to the health. The second is the paradoxical treatment. This treatment is quite tricky, as you can see from the description. Treating the heat with heat, treating the cold with cold, treating the blockage by blocking method, treating diarrhea by purging, treating metrorrhea by activating blood circulation. So as you can see here, previously we said the direct treatment. We treat the heat with the cold. The heat condition, we supposed to use cold herbs to help. Here we say we treating the heat pattern with the heat. This is the heat herbs or the acupuncture methods or moxibustion. How can we treat the heat? If there's too much fire in the body, you use the fire to treat the fire. That obviously doesn't work. It just makes it worse. So if you treat it wrong, it will be similar that we said in Mandarin. Sometimes we said that you try to use the wood to rescue the fire. It doesn't work. You can't use the wood to rescue the fire. You will make the fire worse. So the treatment of treating heat with heat, it actually refers to this heat. It's the force heat, not the true heat. In this situation, from the excess and deficiency and yin and yang, we have talked about the true and false. So this heat is the manifestation, but this heat is due to the extreme coldness in the body. Extreme coldness, that's the root cause, but this patient manifests as heat pattern. In this situation, you don't be confused by the heat symptoms that you can see. You need to see through the heat symptom and to understand that the root cause is the coldness. That's why in this situation, you still need to use the hot herbs to treat the root cause of this heat. Treating the cold with the cold, that's the same situation. The coldness is the false symptoms. The root cause of this coldness is a heat situation in the body. So if you confused by these descriptions, you need to go back to the pathogenesis, true and false, true cold, false heat, true heat and false cold. Now you will understand. The false coldness is due to the heat in the body. So in this situation, we also use the cold herbs to treat the root cause, which is the heat. Okay, so in the true and false situation, don't be misled by the manifesting symptoms. The treating blockage by unblocking methods. Treating the blockage by blocking method. So normally blockage, we need to use method of unblock. If the pathway, such as the highway, was blocked in somewhere, the treatments we're supposed to remove the blockage in between that unblock method. Then the flow can move smoothly, right? But for this situation, we're going to treat the blockage by blocking method. What's the blocking method here refers to? The blocking method refers to the tonification method. So tonify, to improve the substance in the body. So tonify, it actually means adding something in the body. So when we add something in the body, we actually block somewhere, kind of block, although we don't really. So we use tonify method to treat the blockage. can this work? That's because this blockage is due to deficiency. For instance, if the pathway, you just imagine here's the pathways of the flow. Because of deficiency, so we don't have enough substance to support the pathway, so it becomes smaller, even blocked, so nothing can move. But this is because of deficiency. So in this situation, we will improve the substance in the pathway to unblock, to push, to unblock it here. Let's use the blocking method for the blockage. For this condition, the blockage is due to deficiency. There's another example that's treating diarrhea by purging. For diarrhea, we normally use some methods to stop diarrhea, to stop the movement, but sometimes we will use some purging method begin to cause diarrhea, to stop diarrhea. How does that work? Is that the way of thinking that this diarrhea is due to the excess pathogens in the intestine. So for this situation, we need to help the intestine to clear the excess pathogen in the intestine. That's how you can stop the diarrhea. We don't stop them directly because if you stop the diarrhea directly, you're going to keep the pathogens in the intestine, which can develop into a worse situation. So for this situation, we're going to cause diarrhea to help the body to get rid of the pathogens in the intestine. Once the pathogens in the intestine goes out of the body, the diarrhea also will be healed. So that's the paradoxical treatment. The last example we're going to discuss the treatment for bleeding, the menstruation bleeding by activating blood circulation. For instance, if someone suffers from excess bleeding in a period, such as the period can for 2 weeks, even 3 weeks without stopping. In this situation, we can use some treatments stop bleeding, but in some situations, we're also going to activate the blood circulation. Because if we use some herbs or some acupuncture methods to increase the blood circulation, to activate the blood circulation, we can help the uterus to remove the blood stasis in the uterus. Once the blood stasis, the static blood in the uterus has been removed, the blood will stop. So that's the paradoxical treatment. So as you can see from here, our treatment method, we got all these different treatment methods. How can you choose which one is suitable for which situation? You need to choose from the root cause. Don't be confused. Don't confused by the manifestation. You need to find the root cause. Which is the root cause for all these manifestations? Then we treat the root cause. So these are human principles. The other the other principles is treating the manifestations or the root causes. In this situation, we need to discuss the acute condition and non-acute condition. We want to treat the acute conditions, when to treat the root cause. So for acute situation, we need to relieve the symptoms immediately. Don't care about what's the root cause. For instance, someone got a heart attack. they feel chest pain. The principle of the treatment, you need to eliminate the pains directly. Doesn't matter the chest pain is due to water retention in the heart or the blood stasis in the heart, or someone such as the lady with asthma. The acute attack, you need to relieve the breathing immediately. Doesn't matter due to lung coldness or lung heat. That's the manifestation. So in the acute condition, we need to focus on the acute condition. We need to relieve the symptoms directly. And in a non-acute condition, we need to treat the root causes, such as again with the asthma. For this lady, if the cough or difficulty breathing has been relieved, we need to tonify, strengthen the lung function, the spleen function, or the kidney function to recover, to prevent the asthma happen again. That's also the prevention. So that's the treating the root cause. We need to, from the symptoms of asthma, difficulty breathing, coughing, we need to figure out what the root causes. Then in a long acute condition, we need to treat the root cause to prevent it happens. That's the principles in the previous video that's begin to restrain the disease become aggravation. So that's the principles in between the manifestation and the root causes. Treating the manifestations and the root causes at the same time. So these two, the manifestation and the root causes, they are not conflict to each other. You also can treat them together at some stage. So in our treatment, in our clinical practice, you need to use these methods more flexibly, reinforcing antipathogenic qi and dispelling pathogenic qi. Reinforcing antipathogenic qi refers to improve your body constitution, improve your immune system, and to improve the recovery or repair of the impairments, the repair ability of the impairments. Dispelling pathogenic qi means to dispel the pathogens or eliminate the pathogens to stop the impairments. So sometimes we use these two methods together. You can use one, you also can use together. It depends on which one is dominant, and also depends on the cause of disease. Sometimes we reinforce the anti-pathogenic qi first, and then dispel the pathogenic qi, followed by dispelling the pathogenic qi. In some situations, we're going to dispel the pathogenic qi, and then followed by the reinforcing anti-pathogenic qi. It depends on the patient's body constitution. Also depends on the patient's anti-pathogenic qi. The fight, the struggle between the anti-pathogenic qi and pathogenic qi, which one is dominant, which one is important. So we can choose either of them or both of them. We can use the reinforcing at the beginning or at the end. We also can use dispelling method at the beginning or at the end. So we can choose these according to the clinical symptoms. The next one is regulating yin and yang, eliminating the excess. Eliminating the excess yang or eliminating excess yin. This is refers to the excess patterns of yin and yang. Yang prevails, we're going to eliminate the yang. Yin prevails, we're going to eliminate the yin. So that's how to recover back to the balance situation, tonifying the deficiency. So this is actually refers to from the pathogenesis. It says the first we discussed the excess and deficiency. For the excess, we try to reduce them. For the deficiency, we try to tonify them. We're going to tonify yin for yin deficiency situation. We're going to tonify yang for the yang deficiency situation. We also can tonify yin and yang together because yin and yang they can mutually generate each other. We also can help each other. So these are some of the treatments principles regarding the yin and yang. Yang is very important. So even for some yin deficiency, we also going to tonify yang because the yang can confine qi, which also include the yin qi. That's the regulating yin and yang. Regulating qi, blood, body fluid. As you can see here, when we talk about the pathogenesis of disorder of qi, blood, body fluid, we always divide them into two: the disorder of them and also the disorder, the abnormal movements of them. So the principles of them is to, for deficiency, we're going to tonify the qi, tonify the blood, tonify the body fluid. For the abnormal movements, we're going to regulate the qi movements, we're going to regulate the blood circulation, we're going to regulate the water metabolism, such as the qi counterflow, such as vomiting or nausea. The qi move upwards, which is supposed to move downwards. So in this situation, we're going to use some method to regulate the movement of qi, to bring the qi move downwards. That's how we treat the nausea. And for the water metabolism, dampness, phlegm, and water retention, these are the pathological products of the pathogens. So these pathogens we need to dispel, to get them out of the body. That's how to regulate the body fluid. Treatments in accordance with the time, geographic location, and individuals. So this is the principles in our treatments, in all kinds of treatments, according to the time, according to the geographic location, according to the individuals. So these three according to are very important in our theories. According to the time, that's the example is that if someone suffers from flu in winter and someone suffers from flu in summer, we may use different treatments. We may use different herbs or acupuncture points because this time is different and our human body in different time also we have different symptoms, different causes. So we're going to treat according to the time, according to the geographic location. So different areas where they live can be different, and this also will affect the disease. That's why, for instance, now the COVID-19, it happened in China before, and now in many countries we also have COVID-19, but the treatments we don't use the same treatments from one place. Even in China, although we use Chinese herbal medicine to treat the COVID-19, which is from the news that 90% of the patients were treated by the herbal medicine and more than 91% were recovered. So we can see the results of the herbal medicine treatments are actually very good. As when you see in details, you will see that the herbal medicine is not from one formula. We use different type of ingredients in different areas of China. As you can see, China is very big. The geographic location will affect the climate in the north and in the south. From the north to the south, by flight, you need to fly 6 hours. Then you will see how, sorry, not 6 hours, almost 6 hours. Then you will see how big China is, the geographic location. So the size of China is 8 times as big as South Africa. And you will see even from South Africa, from Joburg and Cape Town, we got different climates. And if you imagine the other countries in Africa or in Europe, we got different locations, we got different climates. So even for the same disease, for COVID-19, we need to use different treatments according to the geographic location. The last according to the individuals, different people, different patients, they will have different symptoms, they will have different age, gender, and body constitution. So we need to treat these individuals according to their specific symptoms and causes, specific pathogenesis. For example, now because the flu or COVID-19, even COVID-19, at the same time, sometimes we don't use the same treatment because your body constitution is different from others. That's one. If you study in a classroom and then 2 of your classmates got flu, you might use different treatments towards them. That's at the same time, the same place, according to the time, the geographic location, these two are the same, but different individuals, we might use different treatments. So we don't have one set of standard treatments for everyone, for one single disease. Our treatments need to base on the time when the disease onset, on the geographic location where the patient lives, and on the individuals. So these 3 according to importance in our theories. And until today, we have finished all our theories study of Chinese medicine and acupuncture. So after the discussion of the basic theories, we need to use these theories to apply into our practice, to apply into our daily life. There's some of you that says that in the theories, why don't we have some practical training? As you can see from here, the theories be more training the way of thinking, be more training the way of how we understand the disease, use these theories, and how to use these theories to analyze the phenomena in the environments, the phenomena in the clinical practice, such as now the COVID-19. How do we understand the COVID-19 in Chinese medicine? How do we understand the disease? How do we understand the treatment plans for the disease for COVID-19? How do we understand the prevention method of COVID-19? Why we need a lockdown? Why the herbal medicine for the COVID-19 varies a lot from different areas. These are some of the questions that you can ask yourself. These are the practical training mentally. The more you think about this, the easier you will be in your future study, because as long as you have this way of thinking, you will make your future study and practice much easier. All what we need to train from the theory study is we need to train the reflection. When you see the red tongue, you will reflect in your mind directly. That's heat. If the cold situation, the cold fingers, if you feel your friend's fingers very cold, you can reflect that their body condition is in cold situation. So we train the reflection. The more you think, the easier it will be, and the more flexible you will be in your future practice. So for the basic theories study, we're going to stop here, and please revise them. And from next video, we are going to continue the discussion on the diagnostics. So from the theories is we gave you the symptoms and signs. We try to help you to understand what's the cause of these symptoms, what's these signs. From the diagnostic study in future, that's the method, the technique to find the symptoms and signs from clinic, from your patient. You need to gather the symptoms and signs. Okay, we're going to stop here. Thank you guys. If you have any problems, any questions, please feel free to email me. Okay, thank you guys.